First of all, I would like to thank you for the very warm welcome. And I would like to congratulate the World Medical Association and the Turkish Medical Association and the Turkish Chamber of Medicine in Istanbul. I think it's a very interesting topic, and being together with colleagues, once more as MSF, we think that we are not alone. Because time to time, in the battles that we're facing, in the challenges that we're having, we sometimes feel alone. But having all the medical association discussing the topic, I think give us a bit of more hope that things will be better in days to come. So I will try to share with you a little bit how we see the situation that is developing today from the MSF point of view. As was mentioned, from an organization that was founded in 1971 with an aim to provide emergency medical care to people, and at the same time to bear witness on what we see in the field, and to bear witness on behalf of the people that are facing barriers and neglect. Of course, that said, currently we are present in more than 64 countries, and out of these countries, 30 of them have a refugee profile. So experience of MSF on what I'm going to share with you is an experience coming from the field, from our staff, and we're talking more than 30,000 health professional, logistician, administrator are currently in the field. Just to clarify why MSF is involved. First of all, we don't focus on the phenomenon of migration or on the phenomenon of the refugees. We focus on the impact that are having the restriction and other controls on the health and the dignity of the person affected. And of course, because we cannot cover all the needs of all the people fleeing, more than 60 million people fleeing all around the world, of course we try also to focus on the most vulnerable ones that are among the migrants and the refugees, and trying to cover their unmet medical and humanitarian needs. That's a bit of snapshot that is changing almost every day. That's a snapshot that is taking place at the borders of Europe, where 1 million refugees, they arrived last year, and currently, as I'm speaking to you, more than 100,000 people have been crossing to Greece. And this is something that is ongoing, even though I have to tell you that what we are seeing today in Greece, for me personally, being present in working in Central Asia, in Middle East and in Caucasus, I'm shocked with what I've been seeing currently in Europe that is being going on. I think I had looking through the TV pictures, I thought that this is something of a movie and not of a reality that we're facing today in Europe. Of course, if we want to talk about to whom we are addressing, all of you know that people are coming with a cumulative vulnerability. People fleeing the war, people fleeing difficult situations. Their medical and humanitarian needs are unmet. But the most important thing, and I think this is the moment that we as the medical associations need to raise the voice, that there is an absence of the political will, or it is poor, both the political will on our countries. Just to understand a little bit, facing the situations with migrants and refugees, when one road is closed, another one it opens. It's like the water flow. MSF have been seeing how this movement of people is going on. We more and more see a refugee profile. And I'm talking about more refugee profile because there's nothing wrong with migration. But currently, 90% of arrivals in Europe are people coming from refugee, even though it's a bad word saying producing countries, because countries that don't produce refugees, the war they produce refugees. More women and children we see, more families, and not young men who are looking for a job. We see more and more the violence by the state actors. Violence at the external borders and internal borders. I cannot forget pictures of the police violence in Kos Island. I cannot forget the picture of the former Yugoslav Republic of Macedonia violence at the borders with Greece. I cannot forget the pictures of the police in Hungary, in Croatia. And this is the Europe. Yeah? This is the violence being taken. And the most important thing, it is the loss of human dignity. The way how people have been treated. We see more and more people pushed back everywhere, pushed back on the sea, pushed back at the borders, pushed back from our yard, and let that be on the yard of another person. And of course, we count more and more people dying. Currently, there are 412 people that died only for the 2 months are not yet over. Let's focus a little bit on these restrictive policies, because we're living with that and sometimes we don't realize. First of all, we are living in Europe detention as a deterrence. More and more is being more user often, considering that we're detaining irregular ones, but not the refugees. Very, very bad and very poor reception conditions. And this is used as a deterrence, because people, and I can quote politicians on the central level and local level in Greece, saying that if you build a toilet for them, more people will come. And we have been proving that humanitarian assistance is not a reason for somebody to flee. It's not a bar of soap. It is not a meal that you're providing that people are going to flee. They will not enter into the sea together with their children and families for that. We are getting more and more the externalization of borders, controls, and containment. European Union is negotiating with Turkey, and next week they're going to discuss that Turkey needs to manage the business. Libya needs to manage the business, and not European Union. The same thing it goes with European states. They say Greek has to manage the business. We talk about closure of borders. Currently we're using and we're seeing more than 20,000 people walking on the streets of Greece because the borders with the former Yugoslav Republic of Macedonia are closed. They were closed in November for the rest of nationalities, considering that Syrian, Iraqis, and Afghans can pass. And now Afghans cannot pass. And Syrians and Iraqis, they don't have it, but they cannot pass. This is a game that is happening in front of our eyes and every day. More and more, our governments have been promoting the so-called voluntary return policy. Voluntary return means you want to go to your country, we'll give you some money and you go home. That is the voluntary return. Not to mention the famous readmission protocols that we're proud of charters and flights of taking people back. Taking people back where? Taking people back on the countries there is war? How is that possible? And of course, looking at these restrictive policies, as MSF, as medical doctors, what we see the impact of these policies. We see discrimination on access to healthcare and lack of healthcare. In theory, I heard some of you, in theory, yes, it's like that. But in reality, it is not. People are not having access to healthcare. There is a violence, and there is violence, a violation of human rights. And it's a very important thing that as a medical association, we talk and teach people what the human rights are. Because people, they talk on behalf of human rights, but they don't know what the human rights. And access to health is one of the human rights. We talk about ill treatment. Yes, ill treatment is going on currently in Europe. Somebody I heard before a bit about the quality of services that doctors can provide and all this stuff. We are providing ill treatment. And sometimes the condition that migrants and refugees are facing European soil, it is going on definition of torture. We are torturing people on the way how they're living. I will share with you in a second picture, so there'll be a bit of reality. It's not a theoretical approach. We have people with chronic diseases and interruption of chronic treatment, be it the hypertension, be it the diabetes or HIV, AIDS or tuberculosis, and other chronic diseases. We talk about mental health disorders. Mental health disorders of people that have been facing and fleeing violence and coming and receiving a reception in Europe that is increasing their mental health disorders. And of course, in a second I will share with you the correlation between the living conditions and the standards relating to health. Because what is health? And we can talk about health and definition of WHO about health. It's physical, mental, and well-being. In a second I'm sharing with you what and how we see it. And of course, we see human trafficking ongoing. Of course, everybody says 10,000 children unaccompanied were missed in Europe. How? How they can miss 10,000 children? Women have been victims of sexual violence in the way. Of course they are. What is this? Is this a surprise? No, it's not. If the state is not there, others can take their place. Just for you to remind the 3,771 human beings, because numbers are people. They lost their life in the Mediterranean Sea. We hope that 2016 cannot happen again. It's ongoing. That was the welcoming of Europe to people. That is the Europe of democracy and human rights. 1 million people were welcomed with razors. We were able to build up walls to receive refugees. And I'll come to a second how much we spend on razors, police, coast guards, military, and how much we spend on medical care for them. That is the welcoming of human beings in Europe. The beans bags that were used as a shelter, that are being used even today. That is the welcoming in Central Europe. People who don't want these people to come. that is welcoming in Greece. That is in Lesbos. And this is the picture that you can see it almost everywhere. Now, what I'm prescribing to you is something that we see every day. We see in the countries of origin, and unfortunately, these are our patients also when they arrive in Europe. We see them in Greece, we see them in Serbia, we see them in Croatia, we see them in Italy, we see them in Calais. So we are together with them, following them, and this picture that I'm sharing with you, it's coming from our own experience. In Greece, we're working since 2008. Of course, our work is since before, but on the so-called now refugee crisis, this is since 2008 is taking place. It's not a new one. What we do as medical activities, we provide primary health care, we provide referral to the hospitals and accompaniment, we take care of sexual gender-based violence, we visit and work in detention center reception facilities, providing mental health care, non-food item distribution, including hygienic kits, including clothes, including building up shelters, toilets, showers, tents in Europe. I'm just prescribing Europe. At the same time, we try to take care of the victims, survivors of victims of torture. And something that we did and started in 2015 is search and rescue on the Mediterranean Sea in order to save lives of people even in the sea. A medical organization doing search and rescue. These pictures are not from very far away. These are pictures of our activities somewhere here in Europe, in different locations. These are new areas and locations where you can find today people on the move. We need to do mobile clinics for them. We need to treat them in the gardens of the coast guards and the police stations. And as I said, we follow them in all the way to reach Central Europe. Our work for 2015, starting in the Greek islands, it started this March in Dodekanis, in Lesbos Islands, in Samos and in Athens, providing medical care, water and sanitation, and logistical support. And from April 2015, we are at the borders with former Yugoslav Republic of Macedonia, trying to be there and see the suffering of people since April, and the pictures that you see today, there are pictures that we're living every day. That is the picture that you see almost daily at the borders with the former Yugoslav Republic of Macedonia. Now I'm sharing with you that today there are 3,700 people at the borders, and 20 kilometers from there, there are 1,700 more waiting to go. And others are moving in the street of Greece in order to reach the destination. As medical people, let's talk a little bit about what we see for these people. Talking to the refugees arriving in Greece, majority of them, 80% for them, said that they were forced to flee. And then they left because of bombing, life threats events, witnessing violence and receiving threats. This was before these people migrated. During their migration, they talked to us about physical violence by state actors, police, coast guards, and other stuff. They talk about ill treatment inside of their own community or from other communities. They talk about family killed. People had to leave family members at the mountains between Iran and Turkey, on the Aegean Sea and the Aegean Islands, and to continue their treatment. And of course, they talk about life-threatening events that took place through all their trip. Especially if we talk about 50% of them, they mentioned that they knew when they entered into the boat or to the dinghy, they knew they were dying. Imagine the psychology of a person who says that he knows that 50% of them, they know that they are dying anyway. So there's no hope to be in Syria, there's no hope to be in Iraq, in Afghanistan. So if we have a chance of 50-50 to cross, then probably we'll be on the safe side. Who are our patients? They have a name and they have a nationality. 40%, 42% from Syria, 29% from Afghanistan, 10% from Iraq, 8% from Pakistan, and the rest of certain nationalities. Do the migrants and refugees bring diseases? 93% of the people that we received during 2015, and this is 100,000 patients that MSF treated in 2015, out of 1 million refugees, 100,000 people were treated by MSF. They mentioned that the symptoms of the problem or the disease, it started just when they began their trip and because of the living conditions. 80% of the medical conditions that we treated was related to the living conditions. No shelter, no water, no toilets, no medical care, no food. This is what you are treating. A person coming out of the sea wet, who has to spend the night in -10 or have to spend the night on 50 degrees with no water, no toilets, etc. Where is the UNHCR standards? Where is WHO standard? What a refugee need about? We're able to translate the book for Europe. That's a book of the minimum standards. That's given by international community. A bar of soap. One toilet for 20 people. We talk about no toilet for 100,000 of people. 35% there were upper respiratory tract infection. 16% there were traumatology. 11% there were skin infections. Then 10% there were gastrointestinal conditions. And all of them were related with the living conditions and the people that were traveling. As I said, 80% of our people declared that they were forced to flee. Among them, 17% there were people coming from the vulnerable groups. Majority under 5, then you have pregnant women, then you have accompanied minors, people with special needs, and also elderly people. So that's something that's been increasing. All the mental health parts, the anxiety, depression, and post-traumatic stress disorder were the main symptoms that we have to face among the people. And this is something that you can prescribe only when you have a possibility to see somebody for 1 or 2 days. Because out of 700 patients that we refer to the secondary health care, about 11% did not accept to go. Imagine a pregnant woman that needs 1 day to deliver or 2 days to deliver, and she says, I want to go. Imagine how desperate people are that they want to continue their trip. It is something that is all for a doctor, you know, what can I do now? Yeah, I'm sending somebody to the hospital and the person does not want to stay. And of course, it is very symbolic, the picture you see on that, but it's very important for people and for their human dignity. Imagine yourself, you have a child who has a month without changing the diapers, or women who need the sanitary napkins, or people who need the blankets, emergency food. And I think it is very important to give the people the dignity and to give the right to choice for these people to continue their trip wherever they want to go. And as I said, we're working also on the victims of torture in Athens and working together with other organizations in order also to provide legal care and mental health care for the people who survived torture. It's a new area that we did not work before, and this we're doing it in Europe. These pictures are coming from Greece. So that's the locations we have to work and provide our activities using mobile teams. These are the living conditions that you see. These are the welcoming. As said, in May 2015, we started rescue and search activities in the Mediterranean Sea. More than 20,000 people were rescued during 2015. We stopped in the Mediterranean Sea, and now we are working in the Aegean Sea. Together with Greenpeace, we're doing rescue and search activities, and more than 17,000 people have been rescued and also directly, safely at the shore at the Aegean Sea. I would like to remind you something. It is not very far. Recently, European Union is using more and more detention. You know, there is a European directive who says that the last resource to be used is detention, 18 months. And now, the President of European Council, Mr. Tusk, asking Greece to implement detention as a first choice, 18 months. I would like to share with you what we shared with the world in 2014. This is the welcoming of the people in detention facilities. That is a terrorist. Be careful of him. We are having his data. This is the living condition of Hotel California that migrants and refugees have been staying in detention facilities. This is how we are keeping people in Europe. And because the medical authorities, they wanted to know what can we do with these people that are in detention facilities because they bring us diseases. This is the recommendation of European Center for Disease Control, who says that increased risk for communication diseases in detention, it's mainly linked to severe overcrowding, lack of hygiene, lack of basic supplies, and lack of possibility of outdoors. So basic things that we learn in medicine, we had to face in detention facilities where 63% of total diagnosis was related and linked directly and indirectly with the substandard detention conditions. So what we're talking today as medical doctors, 80% related to travel and to living conditions, 63% living to detention facilities. So we are creating diseases. And how ethical is for a doctor? And our doctors sometimes they say, but I mean, this is unethical. I'm treating him today and he comes back sick tomorrow because the conditions are. So if we can change today, we can change, of course. We don't need to change laws. Laws, it's impossible to change them. we need to change the way of approach. Because in our countries, if you want tomorrow to open a hotel or a restaurant, the medical authorities will come and check your standards. If you have a toilet, if you have a kitchen properly and all this stuff. And if you don't have them and if they're not running properly, they're closing down. What about medical authorities and medical associations? Did they ever go to see these detention centers and tell to these people, you have to close this down because this is a hell? It's happening in Europe and it's not in a third world country. And this is the impact of detention on mental health. 3.2% of the patients, they attempted to have self-harm themselves. I have been seeing people going on the 4th floor and jumping from there, not because they wanted to make a show. Because there was no hope anymore. You keep somebody in the detention center and he does not know why he's there. People drinking chlorine, people cutting their veins, people stitching their mouth. I've been seeing people stitching their mouth with the threat of a shoes. It's something that, like you do anesthesia and your hands are shaking. And imagine threatening your lips with the threat of the shoes. It's unbelievable. There's a report that probably we have better thing to do. You can read this, Invisible Suffering, where we prescribe what the situation in detention centers. Something that we are losing on the dignity of people. When the people, they arrive, they get a number. The 2 children, they have a name. They get a number 14A and 14B. These children, they look at these numbers, and if the photo was black and white, it will take you back to 40s. And Europe is taking the direction towards 40s. People walking in the streets and are trying to find out where the refugees and migrants are, to catch them. Our countries are voting laws that we have to take the belongings of refugees and migrants. Nobody talks about it. How a society would accept our governments taking such kind of laws and voting about it? Are we afraid of our citizens? Are we afraid of our communities? We have to talk, even though as medical doctors, we don't have to talk about medical things. We have to talk about, is this as a right? We are citizens of this community. European Union is not listening to us, but our societies, the one who are voting the people, and the one who are accepting our leaders to take us on that direction, we are part of this society. And I think we need to address our societies. And as medical doctors, I think will be heard by people. Because you are academics, you have a voice, and it's not an NGO, but it's an academic who talks about it. On 19th of January, we released a report. It's called Obstacle Course to Europe. Please, if you don't have something better to do, read it. There is a summary of it for people who are sometimes lazy to read, but I think it's really important to see the facts faced there. And then I would like to ask you and the Medical Association and the World Medical Association to join our voice on providing safe passage. The fences and the border of Europe are killing people. We are talking about safe passage of people. It is something that's their right for international protection. Today, European borders are closed. We need to open a safe passage for people in order for them to ask for international protection. Please join our voice and let's make it possible that this safe passage is open to people in order to provide them the right to live, the right to health, the right to survive. And do not forget that these are the same patients that are coming from the countries where MSF is being bombed. So imagine, who are these people? Are the people that they are living together with us? And if you know very well, and World Medical Association and Turkey Medical Association have been supporting MSF on the voice, stop bombing our hospitals. The hospital in Kunduz where 42 patients and doctors, patients were burned on their beds by the American army. And Mr. Obama had to ask for an excuse. A week ago, the hospital in Syria was bombed. A few weeks ago, the coalition of Saudi Arabia was bombing our hospitals in Yemen. So we're asking to stop bombing our hospitals because even in that location, we are not able to provide support. In Europe, we cannot provide the minimum standard that we can provide. So we're seeing more and more barriers. So we're asking you to join our voice with us. And what our international president said a few days ago when he released the report on bombing of health facilities in Syria is that the doctor of your enemy is not your enemy. And I think it's very important that this message goes through to the people because even war has rules. And I will close my speech with a 1-minute video and then I'm done. Welcome to Europe.
Thank you, apostolos, for this very engaged and courageous speech. I think the applause of the audience already showed you how this was received. I would like to tell you, of course, that we all can become members of Médecins Sans Frontières. So maybe this is a slight, a little aid in the sort of advertisement block, which we should have even for help organizations like Médecins Sans Frontières. Now we are open for discussion, but before we start the discussion, I have some very short and brief housekeeping notes. At the end of the discussion and before we all move out to fill our stomachs, I would like to ask you to stay either in the room or move somewhere because we want to have a family photograph taken. We will be shepherded somewhere where this family photograph can be taken, so please don't run away after the discussion. Someone will bring us to a location where a family photograph can be taken. Now, we're up for discussion. And if I may do so, I would like to start with the first question put at Apostolos. The question is simply, you have told us a lot of the important things Médecins Sans Frontières are doing. And in your question, which you asked at the discussion earlier on, you already showed some concern about the actions which we are taking. So I would like to ask you, what do you expect us from national medical associations to do to help refugees, to help migrants, and to help MSF?
Well, first of all, I would like to thank you all, and I think like this I feel a bit better. Sorry for my emotional situation, but it's something that if you live it in daily basis, was also a psychosocial debriefing, so I would like to thank you for the psychosocial debriefing that I had. I think it's a very important thing that definitely as a member of a medical community, when we cannot be in the field because our professional life does not allow, if we are not able to provide direct or indirect services, I think it is very important, and what we expect from the medical association worldwide, we expect a position that is addressing the governments and is asking the governments to consider that access to healthcare and human dignity has nothing to do with the legal status of people. And I expect the medical association to come in front. I expect members of medical associations to go to media and talk about it. Because currently at the moment, because of the border closure, everybody talks about what about diseases these people are bringing, how dangerous these people are. So I think, don't expect that you are going to change the world from one day to another. But if, as a medical association, you come in front, and why not to demonstrate? I really appreciate when the medical association, they come in the street to demonstrate when their rights are not being respected, whether their salary is being cut or their overtime is not being paid, etc., etc. I think we need to raise our voice as medical association, considering that these people have minimum rights to be expected. And I think if the medical association in each location, and I think it is very important to consider also medical association of countries that have been showing no at all willingness to receive refugees. And these countries that are talking about not receiving, against the refugees, they did not receive even one. So I think it's very important that if there's a medical association, they are part of the World Medical Association, the minimum thing that they need to do is at least to come in front of that. They don't have to feel afraid. And I think that's the point, that many medical associations, I'm not generalizing all around the world, but some of the medical associations, they are afraid of taking a position saying that human rights and dignity of people, it's an important thing. So I'm really, I would like to ask a call to the medical associations to come in front and talk about who are these people, what are their rights and their needs. To join our voice, both including safe passage, but also the important thing of the respecting the minimum medical and human right conditions.
Thank you. Now we have one question from our Greek colleagues, and I don't know who of you is going to speak, but you can present
on
yourself.
Behalf, it's just a small, brief intervention, not a question to Dr. Veizis. As the Pan-Hellenic Medical Association, and on behalf of the President, Dr. Vlastarakos, we would like to address a great thanks to the organization Médecins Sans Frontières, and to you personally, Dr. Veizis, for the great. For your great offer in the Greek region, in Aegean Sea, and worldwide. Without you, healthcare in our country wouldn't have this humanitarian aspect. Wouldn't be in that great, just as human as it has to be. Thank you so much.
Thank you for this intervention. Questions? Yes, please, at the backside. I am afraid I do not know your name, but you can introduce yourself.
Doktor Nazan Aksaray, Türkiye'de bir hekimim ben. Eskişehir Tabip Odası'ndan katılıyorum. Çok teşekkür ediyorum güzel konuşmanız için. Sınır tanımayan hekimlere, size çok teşekkür ediyorum. Hepinizin önünde saygıyla bir kere tekrar eğilmek istiyorum. Türkiye göç alan ülkeler arasında en üst sırada. Türkiye'deki yapılanmanızı merak ediyorum ve samimi gözlemleri, eğer bir yapılanma varsa, kusura bakmayın ben gerçekten bilmiyorum bunu. Türkiye'deki samimi gözlemlerinizi de merak ediyorum. Mülteciler için yapılan.
So, of course, as a medical humanitarian organization, we are not to replace the governments. And always, before doing any interventions, we do always an assessment of the needs. We see what is the capacity, responding capacity of the governments and other actors. And the aim of MSF is not to replace the governments. Regarding Turkey, I have to tell you that yes, we are officially registered in Turkey. We have an office in Kadıköy. Currently, we're implementing projects for the refugees from Syria in Gaziantep, in Kilis, in Suruç. And we are in close collaboration with the Turkish authorities. And based on the needs that will be probably appearing and MSF can have an added value, we will see and consider the situations. Thank you.
Thank you. I see the next person that wants to put a question down there. No, thank you. I have that. No, I was just trying to tell you in advance who is the next speaker, so we don't lose so much time passing on the microphone. So, that young man at the far end of the corridor on the left-hand side, if you could give him a microphone, he could put his question. You don't have to thank me for the young man.
That's a great empathetic statement. Thank you. I'm Levent Küye. I'm a psychiatrist living in Istanbul. And I'm also a board member of the European Psychiatric Association. Thank you very much for your excellent, not only thought-provoking, but also hope-provoking presentation. I would like to make a couple comments and a question. My first comment is that I strongly support the wording you used. You said so-called refugee and migration crisis. I think this is one of the most critical hot topics that we should discuss and reflect on, because this is not a refugee crisis or migration crisis, which is usually used in official papers and so on. This is the crisis due to war. This is the crisis of forced displaced people, as very well documented in your statistics, that most of the people, about 3-4%, more than 50%, were forced people, forced violence because of violence due to war. So I think this is important, at least being a psychiatrist, I find it important. Our discourse is important because it also structures how we think and formulate the situation. I think this is connected to the couple facts. It has been more than 25 years since the fall of the Berlin Wall. In 2014, during the celebrations, there was a big pancart, a big poster in Berlin saying that in 25 years where the wall existed, there was 136 deaths on the border of the wall. And since the fall of the wall, there are more than 30,000 deaths on the borders of European Union. Shame on us, as you had strongly emphasized. And my question is linked to what you had said during your presentation at the end. I have the fear that the politicians and the states are trying to medicalize a psychosocial phenomena, medicalize a tragedy, humanitarian tragedy due to wars, and medicalize the situation and push many NGOs, civil society, to solve the problem. And I know it from, at least from Turkey, in many parts the state does not take the responsibility. The politicians who are some part involved in the process of the war, here or there, and they kind of leave their responsibility to medical people, to us, to psychiatrists, to medical people, associations, and so on. And that creates an issue for us to be very sensitive, not to medicalize the situation in which your presentation you had stated. Connected to that, I'm finishing. Thank you for giving this opportunity. I agree that racism and discrimination is going up. It's obvious from the razor wires and new borders. There are 65 new borders built on borders of the world in the last 25 countries, including Europe. What could we, as doctors, medical doctors, and allied professionals, do to create increased hope against racism and discrimination? Thank you.
Thank you for your question. First of all, I have to tell you that for us as MSF, the so-called refugee crisis is a reception crisis. 1 million people, it is 0.2% of population of Europe. Lebanon has a population of 5,800,000 people and has in its territory 1,800,000 refugees. I'm not talking about Turkey, but I'm just to give an example that for us, this is a reception crisis for Europe, because in addition not to do anything, with opening and closing of the borders, with no reception facility, it's increasing the suffering of people. So not only they are trying to solve it, but at the same time, they are creating even more problems for people. I think it's a very important thing that from our side, as medical association, we need to raise a question. How easy for our governments is to mobilize NATO, Frontex, Coast Guards, militaries, police. Everybody talks about screening, fingerprints. Everybody thinks that everything is linked with terror. Why as society we are silent accepting this type of position? And I would like to ask you, have you ever asked the Ministry of Health how many health workers they've been sent from the Ministry of Health in order to respond to the refugee crisis? None. None. So definitely the work that medical doctors have been doing in the hospital, it's amazing, even with the less resources and economical crisis. But I'm talking about the state response. A state response in order to cover the medical needs of these people arriving. And that, as you said, they find sometimes an excuse to NGOs. As MSF, I have to tell you that we don't take a single penny from the Greek state or from European Union in response to the refugee crisis, because we believe that this crisis is part of their own political agenda, and we don't want to be part of that agenda. Of course, we are there in order to provide assistance to people, but at the same time we're trying to push authorities to take their responsibility. Sometimes it takes a bit of time. So from your side, as you said, as a medical doctors, we can come more in front of this question and see how our healthcare systems can be adapted. Because it's not easy. If you have a system that you have rural healthcare centers and you have hospitals and you have people on the shore, it is not adapted to that. So you need to learn from the experience of the NGOs, probably they have through the mobile clinics, and then to see how to address better the needs. But the most important thing and the minimum thing that we could do as medical doctors is to consider, okay, you don't do something with these people, but at least don't increase their morbidity and mortality. Increasing morbidity, it is by leaving people living without any living facility, no water, no food, etc. And of course, mortality is by building walls. Let me tell you that I've been part on 4 meetings that took place in 2 days difference from each other. WHO special meetings on migration and health. IOM special meeting on migration and health. ECDC special meeting on migration and health. What can we do for these people coming? They bring diseases and all this stuff. Everybody was agreeing that these people are not bringing infectious diseases. But still we need guidelines. I said, what guidelines do you need? Okay, I will give you the guidelines, but who is going to implement these guidelines? You don't have a single doctor working with these people. So sometimes as a medical community, we need also to come out of that political questions. How much money was spent to organize all these international meetings and agendas and all this stuff? And I think on the World Health Assembly that is taking place in May, we need to raise the question that since 2008, World Health Organization, IOM and UNHCR have been agreeing on managing the issue of undocumented migrants at that time. And now I'm talking about people access to healthcare. And every year when they have the World Health Assembly, they were seeing where we are today. We are nowhere. I mean, except some papers that they've been accepting it, that is the right, and the countries have been signing. We need to ask as medical community in the next medical general assembly that is taking place in May to ask the question, where we are today and when, tell us a date, when you're going to implement. I really appreciated the Millennium Goals, or adapted or not adapted or whatever, as the Sir Professor mentioned it. For us as MSF, being in the field and knowing the reality, this is just a dream. It's a dream that in 20 years' time we will say, we did not manage very well, but in 20 years' time we will come and it will come. Reality today, we need to link the reality with the theory. We need to stop the theory and we need to be a bit more practical. Practical means that we need to, as medical doctors, we need to do what we can do. As Professor was saying, we need to provide medical care to people, take care of these people and ask our politicians to consider and to be good students. Because you can fight them with your weapon. You know that the European Commission asked FRA, who is the Fundamental Rights Agency, to do a study and to prove if, for example, provision of medical care to undocumented migrants is more beneficial on an economical side or not providing the care. And the study showed, yes, that this was more profitable by providing access to health care for people. I'll give you an example. If you have somebody who has a blood pressure and he needs a treatment of 30 euros a month, if the person is not getting his treatment and he will get a heart attack or he will get a stroke, the money that you're going to put as a healthcare system into taking the person to a specialized unit, it is a lot of money. So I think people, they want to link always with money, but healthcare is not only money. Thanks.
Thank you for this intervention. I think you mentioned a reception crisis. I think you showed us also we have a perception crisis as well in how we perceive the impact of the refugees coming to us. But there's one thing I would like to wonder. You said, ask your ministries of health what they have, how many doctors they've sent. I was just thinking that my Ministry of Health in Germany would send their doctors from the Ministry of Health, and I would say I'm rather happy they haven't done that, because I'm not sure they would have helped you very much in, they would have helped you in bureaucracy, but definitely not in medical aid. Ottmar, you have a question.
Well, it's rather a comment or intervention to what apostolos said, and I think 2 points where well, it's not a disagreement. I guess you will find this as an amendment to what you said. Number one, you said we cannot change laws, and I think we have to be actually more vigilant on laws. A lot of the problems I see now is caused by extremely incomplete, if not stupid, regulations in the European Union. Dublin Accord is one where I think we should have raised our voice. We probably didn't see what it will cause, but in the end it has been an extremely unhelpful treaty, which was unrealistic from the very beginning and was calling for a humanitarian crisis in the beginning. It may have been good if we had seen that before. Certainly it was complex, but nevertheless it's something where I think we all, as associations, as doctors, individuals, as learned people, should be more vigilant and raising our voice when bad laws are being made. And the same is true for those regulating detention. I think it's a scandal that we treat small children like criminals and put them away behind bars for months, if not for years, as you rightfully pointed out. One thing which we can do immediately as medical associations, and the World Medical Association has called to its members several times now, and I repeat this now, is you as national medical associations can demand to be part of the inspection teams who go out to detention centers. And you can raise your voice and say this is not what it should be, where there is danger to health and where there is danger to human dignity. It's something that the medical associations can do. They can ask their national governments to be part of those inspection teams and speak out. And we really would like to see more of our members, some do already, but we would like to see more of our members being part of those inspection teams and going to those detention centers. It probably costs you a couple of hours to be part of this, but it allows you to raise your voice and to speak out and to tell your government what you think about it. Thank you.
Thank you, Otmar. And we are running a little bit short of time, so I now have 3 interventors. There's our friend from Gothenburg. Men du kan prata inte så långt, vi har inte mycket tid. Then there is a friend from the middle there, and then one person there, and with your permission I would then like to give apostolos the word to wrap it up. Swedish colleague? No, because we need interpreters over there.
Doctors have a very good brand name. People trust us, usually for good reason. Disinformation is a major problem out there. Every time I know the correct data and read a newspaper article, most of what's in there is wrong. I like those data you showed, respiratory tract. I mean, those are people, and we meet these people, and we know the facts about these people. We have a responsibility of handling this disinformation that's going on in the press. And I think this is our duty. We should participate more actively in the public debate. Do you agree?
Of course. In the middle.
Ergün Demir, İzmir Suriyeli Polikliniğinde çalışıyorum. Şimdi öncelikle teşekkür ediyorum. Bu gözaltı merkezleri dediniz. Gözaltı merkezleri bizde geri gönderme merkezleri olarak Türkiye'de mevcut bulunmakta. Gösterdiğiniz resimler aynısı burada da mevcut. Şöyle bir şey örnek vereyim. İzmir'de Işıkkent'te ayakkabıcılar sitesinde var. Bırakın 270 kişilik bir şey 600 kişiye kadar çıkabiliyor zaman geldikçe. Ve sağlık hizmeti personel tuvaletine gidilen yerde bir masa atılarak yapılabiliyor bu görüntüler. Yalnız buradaki sorum şu, sadece devlet yetkilileri değil, bu geri gönderme merkezlerinde asıl sorumlu Birleşmiş Milletler'in kendisi. Acaba o konuda hani girişim yapılsın deniyor ama sadece devletleri de Birleşmiş Milletler'in de bu konuya dikkat çekilmesi gerekiyor diye düşünüyorum.
And the final question on the left-hand side.
Doktor Bülent Nazım Yılmaz, Eskişehir Tabip Odası Başkanıyım. Doktor Apostolos'un sunumunun içeriği kadar bence gerçekleri bizlerle paylaşması aslında salondan bu kadar kabul görmesine neden oldu. Bence de gerçekten asıl tartışılması gereken meselelerden bir tanesi bu. Çünkü bugün hekimlik mesleğinin ya da sorumluluğunun temel argümanlarından bir tanesinin gerçekleri toplumun gözünden kaçırmamak olduğunu düşünüyorum. Biz Türk Tabipler Birliği'ne emek veren hekimler olarak şuna çok özen gösteririz. Devletin resmi politikasının meslek örgütümüzü etkilememesi için uğraş veririz. Bu bizim temel mücadele alanlarımızdan ve ilkelerimizden birisidir. Çünkü şunu biliriz, resmi politikanın, resmi ideolojik tavrın yanında tavır takınan meslek örgütleri doğruyu düşünemezler, doğruyu söyleyemezler ve doğruyu toplumdan saklarlar. Bugün şundan çok mutluyuz ki bizim meslek örgütümüz Tabipler Birliği örneğin savaş karşıtı politik tavır ve mesleki sorumluluk tavrı geliştirmede Türkiye'nin en önde gelen meslek örgütlerinden, kitle örgütlerinden bir tanesi. Ama bunun bedelleri de var. Örneğin birçok üyemiz son üniversite akademik personelinin uyguladığı imza kampanyasına katıldığı için, barış talep ettiği için bugün akademiden uzaklaştırmakla karşı karşıya. Şunun bedelini de ödedik örneğin. 10 Ekim'de Türkiye'de barış talep ettiğimiz için 105 tane yurttaşımızı kaybettik. Katliama uğradılar. Şunu paylaşmak gerekiyor. Eğer Ege'nin iki kıyısında 10.000'e yakın göçmen, savaş mağduru canını kaybediyorsa bunda gerek Yunanistan'ın gerek Türkiye'nin devleti yönetenlerinin önemli katkıları vardır. Bunu tartışmamak, bunu toplumdan uzak tutmak her şeyden önce hekimlik mesleğinin gereklerini yapmamak demektir. Yine bağlıyorum, örneğin burada sağlık politikaları anlamında bir çifte standardında olduğunu söylemek gerekir. Örneğin Suriye'den, Irak'tan ülkemize göç edenlerin sağlık hizmet alımlarında da önemli ayrıcalıklar gördük bizler. Örneğin yaklaşık 300.000'e yakın Ezidinin sağlık hakkının karşılanmadığını gördük. Bunların hepsini tartışmamız gerekiyor ve meslek örgütünün bağımsızlığının bu çerçevede çok değerli olduğunu, bir devlet, resmi devlet aygıtının bir ideolojisi gibi, aygıtı gibi tavır almanın aslında meslek örgütüne en başta çok büyük bir haksızlık olduğunu paylaşmak istiyorum. Ben yine de aynı zamanda Apostolos'a çabaları için ve arkadaşlarına teşekkürlerimi sunuyorum.
Well, thank you very much. I would now like to give Apostolos the chance for a wrap-up, and then you don't move out, we'll all be ready for the photo session.
I will take only 1 second. Well, first of all, there are two small things that I just would like to repeat. Is currently the services provided for refugees or migrants, be that on the famous hotspot or blue spot or detention facilities, the ministries of health are not involved at all. They say this is the police business. I think it's a very important thing that I've been hearing also from the health actors and the Ministry of Health on their presentations saying that, well, this is the police, we don't know about things. While we know very well that most of the Constitution says the responsible for health is the Ministry of Health. So what we need to demand is that the people, the one who is taking care of health of the people are medical staff and not police. Now, why the conditions are maintained like this as a bad reception condition is to pass a message to the others, don't come, because you'll be staying in a very bad condition. But I can prove to and can tell you that even you make them worse, they cannot be worse than in Syria. Last but not the least, as a medical doctor, I do understand all your challenges you mentioned. I think one we need to remind to our politicians is that every war has rules. They need to respect the role of a doctor, and they don't have to bomb our ambulances, our doctors, be that in wherever they all around the world. So I think it's a very important thing that we talk on behalf of our patients that don't have a voice, and also we ask for our rights as medical doctors in order to do our work, and of course not to lose our lives. Thank you.
Thank you very much.